Hello, everyone. I'm Dr. Nina, Director of TOVA Community Health. Welcome back to TOVA Health TV. This is TOVA Tuesday, and we're so excited because, as you know, I always talk to people in our local community who are striving to improve our overall health and wellness. And today I have a special guest for you, Dr. Cynthia Newton. And Dr. Newton is the Director of Partnerships and Programs of the Biomedical, Behavioral, and Allied Health Sciences Center at Delaware State University. She comes to us from New England and has done so much extensive work in food policy, working on healthy eating initiatives, as well as obesity, learning how to make healthy choices. But then she also is an advocate for mental health and making sure that people in our community have the services that they can need to live a prosperous life. So I want to welcome Dr. Newton to TOVA Tuesday. How are you today?
Good morning, Dr. Nina. Thank you for having me. These are all exciting topics. And yes, food is such an integral part of our lives and the food system. It's wonderful to talk about.
Wow. Well, we have so much to talk about as far as, because the seasons are changing. But one of the things that I thought would be great to talk to you about is about growing a garden. So as you know, the prices of food have gone skyrocketed completely. And even myself and my husband, we don't have, a huge family to feed. My grocery bill is extremely high. And I, sometimes don't even have a lot of groceries in my cart. And so we know there's a lot of logistical issues. There's a lot of policy issues around that. But today we're going to focus on some solutions and things that can help you live a healthier life and make better choices. And growing a garden just seems like, hey, maybe that could be a possible answer, or at least a strategy for families to be able to, get into to better and to eat locally. But before we get started, I wanted to just share with the community a little bit about you because your background is just super extensive and you're so accomplished. Can you see this, Dr. Newton?
I can. There I am.
Yes, your beautiful picture.
Oh, thank you.
I just want to let everybody know Dr. Newton received her BA in Politics and Women's Studies from Assumption College, her master's in public administration from Clark University, and her PhD she received in the area of public and international affairs from Northeastern University. As I shared, that Dr. Newton is an expert in food insecurity, food policy, and gardening. And in her spare time, of course, she likes to garden, cook, exercise, and read. Welcome so much, Dr. Newton. And so let's talk about growing a garden.
It can be the easiest thing in the world, or as you scale it up, it can get very challenging. And I will say the little asterisk is you don't always realize your mistakes and how to fix them until the next growing season. Well, you realize and then you have to wait. But getting even a few basic, standard plants, standard herbs, it's not that complicated. You can even do herbs on your windowsill or put them right outside your door in little pots. So that's not, and then that gives a little fresh herb to your, to your meal. And that's pretty easy. But thinking about, what do you like? What do you like for vegetables? What do you like? Maybe you want to put some flowers in because they attract the bees and the butterflies and all the pollinators are wonderful for your garden. But you can start, certainly with plants, and you can get them at farmers markets, at garden stores, even some of the big box, kind of home stores. And you can, if you don't have a lot of space, if you're in an apartment, a small space, or don't have a lot of outdoor space, you can even grow most things in like a 5-gallon bucket. Or, even going, and you don't even necessarily have to pay huge prices. You could even go to a thrift store and buy some big flower pots or some of the big rectangular, kind of planters. And you can do your herbs, you could do your peppers, you could do tomatoes. I would suggest more of a 5-gallon bucket because they do have a pretty deep taproot to get to the water. But again, you can do them all in a small scale. This doesn't have to be a huge undertaking. And just think about where you get the most sun, making sure you water them.
Yeah, that's important.
But I mean, the basics, once you get it planted, whether you start from seed and make your own little plant or you buy a plant, once you get it in the ground or the container, just making sure it's watered and making sure that you just keep up with if it's too damp and the leaves get a little funky or things like that. And then, depending on what you plant, midsummer to late summer, you'll have some of your own vegetables. And if you get really creative with them, you can actually, and not necessarily going into the full like old fashioned canning experience, which a lot of people do, but that's challenging and takes a lot of time, is you can even, blanch a lot of things and then put them up and freeze them and have them all winter. Nothing like having your own tomato sauce all winter.
Yes, that is so true. Now, what is the good time to start gardening? Is there a good time in the year? I mean, we live in Delaware, but I guess that's the Northeast region where we have seasons. So when is this good time to start planning and getting your garden ready?
I would always say you plan all year round. But if, you're the really casual gardener and, you're just putting out a couple pots, you're going to start, certainly start watching as the days get longer, where you get more sun, where you get more direct sun, where you think a good physical location, particularly if, you have mobility issues or there are a lot of animals that come into your yard, or you perhaps have a dog that might be very interested in eating your plants. So you have to take those things, kind of watch those things over the next month or so. And then you're looking at, depending on the weather, getting things in the ground early May. Early May around here. It varies, obviously, depending on the zone. They actually have the country divided into growing zones. Mm-hmm. And so it depends a lot where you live. Like you generally, the further north you are, for example, up in New England, you don't plant till at least Memorial Day weekend. Mm-hmm. But again, most everything goes in the ground beginning of May. So you're really starting to think about it, and going through the next month or so, particularly once we get into April, you'll start seeing plants for sale, signs about plant sales. Mm-hmm. The farmers markets will be getting going for the season again. Mm-hmm.
Okay. So just say someone's a novice, and like I say, I've had gardens over the years. Some years I've done better than others. Some years I've underestimated physical locations and all of those sorts. And that's all part of, gardening. And for someone who's a novice, what would you say the easiest fruit or maybe the easiest vegetables to kind of grow to get started? Someone that doesn't have a lot of experience, what would you suggest?
Tomatoes are always a default. Most people eat tomatoes. I will not say everyone, but most people do. So tomatoes are a really easy default. They grow, they don't need a lot of attention. In fact, they need probably the least amount of attention of anything in my garden, except
just space them out.
Just not getting them so they like twist all together. Although to a point, it happens. Mm-hmm. And sometimes you end up with some interesting hybrids. Mm-hmm. But yeah, the tomatoes are the easiest and they require the least amount of maintenance. And mm-hmm. In terms of work put in to reward, tomatoes, you also get the best bang for your buck, so to speak. Green peppers are very easy. Mm-hmm. And again, those are even something you could grow on your deck, in a container or on, in your yard or, outside your door or whatever. Those are a really easy one. That's what I gave my husband as his starter plant.
Okay.
A lot of basic lettuce greens are pretty easy, and they can also go in a planter.
Mm-hmm.
And then cucumbers. Cucumbers are easy. Summer squash and zucchini are pretty easy, but as soon as it starts getting really hot on outside, the summer squash and zucchini do not like the real hot weather.
Okay, so definitely tomatoes, green peppers, cucumbers, and maybe even some herbs, right? Because they're pretty easy to grow. You can put them in a pot as well. They may
Oh,
not
yeah. Your herbs
direct.
are always easy.
Mm-hmm.
Most of them are easy. But the
Okay.
basics like rosemary, basil, those are easy ones to grow.
Mm-hmm. Now, just say someone, may not be blessed to have a nice sized backyard, maybe to grow to grow a garden. And they live in an urban community. What are some of their options?
Some options. We'll start with the not grow your own. Ideally, and most communities have these, Dover has one, and almost all of the surrounding communities have them in different days. So you could even hit them different days, and some are during the week and some are on the weekends, are farmers markets.
Mm-hmm.
And it's a win-win. You get to help support local farmers and smaller farmers, which are sadly a dying breed in this country
Yes.
for a variety of reasons. So you get to support people that are truly living, working, and working hard. Farming is probably one of the hardest jobs out there. And oddly, it has one of the highest suicide rates of any profession.
I didn't know that.
Yeah, because it's so challenging, because it costs so much, and it's really hard to make ends meet. And the equipment is so expensive.
Mm-hmm.
So it's supporting the farmers market, and then you can get a variety. You can shop around, and maybe you're only looking for greens, or maybe you just want, one squash, but then you might find some homemade soap, or, that's used somebody else's herbs, or, various other things like that. So it also becomes a very, social and fun experience. And a lot of to make it accessible and make fresh fruit and vegetable accessible to everyone is most farmers markets have also started taking EBT benefits. And then you can see, even, people still, put out in their, yard and stuff, they'll put out, vegetables and things that, people can pay a little for, kind of farm stand, or even, just trying to support local vegetable stores, or joining, if you live in a more urban area, more urban than Dover. A lot of cities have community gardens where you can actually rent a plot.
Yeah.
And then that becomes a hugely social experience.
Yes. And I wanted to share with you that I have a good friend of mine who does that, and he enjoys it. He's retired teacher, and he spends his time at a community garden, and he gets out, he gets to socialize with his buddies, and get that good vitamin D sunlight, and he's really enjoying himself. And so even though he lives in the city, he was able to lease space and be able to garden. And so that, for those who may not have the space, that should not limit you the opportunities to grow a garden. So with TOVA Tuesday tips, I always share with the community tips about, living a happy and prosperous life. And one of the things that you said, Dr. Newton, was to join a community garden, because maybe you don't have the room or the space to grow a garden. You may live in an apartment, or your backyard is really small, but community gardens are places where you can go, socialize, grow get a little plot where you can grow some vegetables. As you were sharing, shop at the farmer's market. Thank you so much for that. Growing your own garden. Get out there, give it a try. I also was learning about joining a farm co-op, and even though I live in Delaware and Bear, even if you just drive like 1 hour Northeast, or if you go in Lancaster, there's a lot of farm co-ops to support, and that's an opportunity. One thing that I'm working on is curbing eating out because that's a way you can reduce your expenses. Yeah, and buying produce from a local farmer, as you were saying, that the profit margins are very tight. And as I did not know there was a high rate of suicide in the farmer community. But Dr. Newton, how about any other resources you would like to share?
So there's always, you can always find a lot of information. I mean, if you want to start big, you can go to USDA. If you want some really good and local information, the Food Bank of Delaware has a lot of resources on their webpage. And they even also include recipes. They also have up in Newark, they have a essentially like a little grocery store and cafe. And so those are other options, and they're also much more affordable because, yes, eating out, in addition to depleting your budget, you control
Quickly.
yes, you control what goes in your food if you make it at home, and you don't have to be a master chef. I mean, you can do basics and, get a lot of things that are, somewhat, pre-prepared that, but like rice or, like a boil and bag rice or something like that you don't have to wait so long for. But yeah, definitely eating at home is a good thing. So other resources in this area, I'm always a resource and happy to help you. I can also connect you with the DSU ag folks. There's also a 4-H program at DSU. And yes, and the way it's done by Dr. Banks is she does much more of, she calls it urban 4-H. So it's much more realistic of what the lived experiences are for children, particularly children coming from lower socioeconomic backgrounds or areas of social vulnerability, that they actually, will get more of the experience than the more traditional rural 4-H. So they're also a good resource. Master Gardeners of Delaware, which basically means that you have taken a few courses and shown some proficiency in a variety of gardening techniques. It is one of my goals. I know several master gardeners, and so putting, again, getting people in touch with them, and then they become a good network. And we're trying to build a network of community gardens because there are several in Dover. So if, you're around, we have one down here at Capitol Park. There's one at the downtown DSU campus. There's one at Mount Zion AME Church. So there are more popping up, and trying to get people really much more engaged in this community gardening, because if we all do a little bit, it is much less onerous. And, if we plant the garden and all we, say, hey, can you remember to turn on the sprinkler on the weekends? Or, could somebody come and weed for half an hour? And then you get to reap the benefits is actually very beautiful. As you knew, we grew some wonderful tomatoes out here last year. So.
Yeah, that is so true. And again, because, I guess the food prices are just going up extraordinarily over the last year or two. And recently I was reading that the SNAP benefits, some of the programs and the resources may be reduced in the next couple weeks. Can you talk about that and sort of what the food policy implications of that may be for the community? And what can we do?
So SNAP, Supplemental Nutrition Assistance Program, also known as EBT, also known as food stamps, helps, obviously helps people buy food, not prepared food, but food, not dry goods or home goods like paper towel and tissues and such, but at least being able to buy food. And generally, based on your income and family size, you get a certain amount of money. And the way that that's determined of how the benefits work is actually at the federal level. Every 5 years, Congress passes what's known as the Farm Bill. And this determines, among many things, the prices of subsidies. So these are the things that the federal government will either give an enhanced benefit to meet a ceiling, a basement of, a base price, or, how they will address, growing or falling prices, so that it was designed so that farmers didn't go out of business, and particularly
Mm-hmm.
during bad years of harvest, that farmers, would still be supported. Part of the issue, and this becomes the issue with this disappearing family farms, is that a lot of that money goes to the big, what are called agribusinesses, these
Mm-hmm.
huge multinational conglomerates that, grow food and, meat products, et
Mm-hmm.
cetera, on a just industrial scale.
Mm-hmm.
Um, and so in authorizing those and determining how the subsidies work, who gets SNAP, and there's a lot of politics around whether SNAP benefits should exist, who should be eligible for them. And there's that dangerous word should, because it places a lot of judgments and a lot of
Right.
opinion. And arguably by people that may never have experienced food insecurity or don't encounter it on a regular basis, or, people living with it, or have not, spent their time at a food bank, et cetera, to get really understand how these issues and how disproportionate that, we have 1 in 5 children that does not have enough to eat on a daily basis. In the richest country in the world, we can do better than that.
Yeah.
And so certainly, finding community support, sharing with friends, going to food bank distribution events, even, the food banks that have, kind of grocery store setup, so that you can be a little more choosy about what you get,
Mm-hmm.
particularly if you have dietary allergies, et cetera.
Mm-hmm.
And then certainly keeping in touch with your Congress people, and voting.
Yeah.
I would be a bad political scientist and public policy person if I didn't every chance I got voting.
Mm-hmm.
This is what keeps people in office, keeps them interested. And if you contact your congressperson, whether it's the member of the House of Representatives or your senators, one of the first things that their staff is going to look up is whether you're a registered voter. Because it again supports them. Ideally, they support and everyone and take care of everyone, but are more sympathetic and attentive to the needs of voters, and definitely showing up anytime you can, talking it up, being an example. But on the policy side, knowing, understanding, paying attention, know what the terms are, so when they come up, you're reading your news, you're scrolling through your social media, that when these terms come up, you know what it means. You know what it means when SNAP benefits are changing or ending, particularly if this is something that affects your family or community.
Yeah. Thank you so much, Dr. Newton. I wish we had more time so we could talk for hours. You know that.
Oh, I can talk about this stuff for hours. I love talking about this because it's one of those basic things that everyone, we all eat. We need food for survival and nourishment, and getting people to better understand where their food comes from and what they can do about it, and make it better, make it more accessible, make it more affordable, without, because you'll also notice that the packages are downsizing.
Yeah.
It's a very subtle thing that the food manufacturers do.
I've noticed that prices haven't, but the packaging hasn't.
No, prices have gone up, but the packaging gets smaller.
Yes.
But that's all part of a calculated profit and loss strategy.
Yes.
And so the more you are aware of what things are and how they impact you and why they are, the more empowered you are to make a difference and make good choices for yourself and your family as you are able. Even if you are living in a very food insecure situation, you can still make, certainly getting food from food banks, but you can make better choices with, you get dried beans and you buy brown rice instead of white rice, or just little changes.
Wow. Thank you so much, Dr. Newton, for coming on TOVA Health TV, TOVA Tuesday today.
Thank
I
you for
want to
having
just
me.
I just wanted to end to say that I want to thank you for your tomatoes, as these are some from my garden and your garden. So we were sharing vegetables last summer, and I made some wonderful dishes like okra and tomatoes. And
Mm.
I also shared that in our newsletter, Tova Cares. And I also want to thank you for the work that you do in the community. You are truly committed to making the local community a better place to live and work. But before I end, I wanted to make sure our viewing audience has an opportunity to contact you if they need. You just wear so many multiple hats, but just in case, sharing your email as well as your number at the Delaware State University Capitol Park location. But also wanted you to talk about camp. You planning on doing that this summer?
Yes, yes. I'm looking, and the pictures is so exciting. And
Yeah.
especially since Dr. Nina did a presentation on hydration, and the kids
Yes.
loved it. And
Mhm.
but we're doing summer camp again this year,
Okay.
and our focus for our summer camp is exercise and healthy eating. So getting kids moving, getting them to make better choices, maybe ask for different foods at home, maybe try different things. Apple nachos were a big hit.
Yeah.
Um, and so again, learning these little things, and it was very eye opening, to see kind of some of the reactions, some of the ability or lack of ability of exercise, because of a variety of safety, environmental, factors. Kids don't play outside like the way they used to. Um,
Right.
and it's not safe for them. And so that if you can find ways such as our camp and such to try to engage them physically, and things that they can do in a smaller space, or,
Mhm.
that's, again, that, yeah, that healthy eating, healthy living, exercise, and it will head off disease and such in the future, such as obesity, type 2 diabetes. 2/3 of Americans are overweight. Rates of youth obesity, they were dropping. Now they're starting to climb again. And that's something, that will impact you for the rest of your life. So it's better health outcomes and less trips to the doctor and less things to deal with as you beautifully move further into your wiser years. We're not getting
Well,
older, we're getting wiser.
we're getting wiser. Absolutely. Thank you so much, Dr. Newton, for joining us today. I want to thank Dr. Newton, who is the Director of Partnerships and Programs of the Biomedical and Behavioral and Allied Health Center at Delaware State University, for joining us today. If you like this episode, please be sure to subscribe to TOVA Health TV. And if you could make a donation to TOVA Health TV, we would appreciate it, because it takes a lot of time and resources to put great content together for our community. You can make a donation at Cash App at $TOVA Health, or to our PayPal account at contact@tovacommunityhealth.org. Once again, I want to thank you, Dr. Newton, for coming on TOVA Health TV. I hope you have a wonderful day.
Thank you. And thank you for having me. You too, Dr. Nina. I'll see
Take
you later.
care.